Hello, welcome to this webinar on PILA Phase One, Preparing for Implementation. As you know, PILA stands for Prepare, Implement, Learn, and Adapt. Today our webinar will focus on the Prepare phase of the PILA cycle. I'm Christina Foster and I'm a consultant for the AOK Networks project. Let's get started. Our webinar today will focus on the fourth phase of our assessment, planning, and action process. In phase 4, our focus is on implementation and continuous learning and adaptive action. The essence of this phase is taking action to generate system changes and better outcomes for children and families. We do this through a series of implementation cycles which help us learn what works and what doesn't work so that we can adapt our strategies until we begin to shift the system and better serve children and young families. This process is what we refer to as continuous learning and adaptive action. Let's take a look at our objectives for today's webinar. In the first implementation webinar, we focused on how to make our strategies more powerful through effective implementation. We looked at the many challenges of implementation, described why we need an iterative approach to strategy design and implementation, and learned our continuous learning adaptive action implementation approach, which is designed around the series of PILA cycles. In this webinar, the next webinar, and the face-to-face training in March, we will dive deeper into each phase of the PILA cycle. In this webinar, our focus is on the prepare phase. Before we do so, we will learn about 5 conditions for effective implementation. These are our objectives for today. So what do we know about strategy design and implementation? We know that strategy design and implementation is an iterative process where strategies are made more powerful, effective, and scalable through small cycles of preparing, implementing, learning, and adapting. This is what we refer to as continuous learning and adaptive action. In the last webinar, we learned that implementation is actually executed through several cycles where we test out and learn how to make strategies more powerful and effective as we go. This is important because in complex systems and with complex problems, we can never really know what will work and what won't. The best we can do is design strategies that target specific system root causes, then embark on a continuous learning and adaptive action process to discover what will actually work. At the core of our continuous learning and adaptive action process is the PILA cycle. Let's do a quick review. As we said, PILA stands for Prepare, Implement, Learn, and Adapt. By cycling through these phases in a series of cycles, we can make our strategies more effective and powerful. Prepare is where we do due diligence and making sure we're ready to implement. We'll be talking more about that today. Implement is where we test our strategies. And I just want to say that even in cycle 3, where we've gone through several cycles prior, we're still testing. Even when we've achieved results, we still have to pay attention to what is working and what is not. Why, you may be thinking? Well, it's actually quite simple. The fact that the system is dynamic means it is always subject to change. What worked at one point in time may no longer work if some parts of the systems change. Think about the dramatic impact of the lack of a state budget a few years ago and the many effects that it had. Learn is where we intentionally reflect on what worked and what did not. This may be one of the, if not the most powerful skill we can bring to this work. Without reflecting and learning, we cannot adapt. Without adapting, it's not likely we'll be successful over time. Adapt, we quickly adapt to enhance or expand our strategies until we find what works and until we get the results that we're looking for. And obviously, we repeat this cycle as needed until we get those desired results. Before we go on, I want to address a common question about these cycles. Some of you may be wondering, do we always go through 3 cycles? While there are few absolutes in systems work, generally speaking, you will want to consider 3 cycles. The first one being a very small scale prototype of some aspect of your strategy. Then the second cycle often focuses on implementing the full strategy with a specific audience and or setting. Then in cycle 3, you begin to go to scale by expanding your strategy to reach more people and settings. With each cycle, you're increasing the scope of your implementation and learning more and more about what works. And as we explored on the last webinar, it's certainly better to fail fast during early initial cycles than when you're attempting to work at a larger scale. So with this basic review, let's pause to reflect. For this reflection, I want you to begin to think about your competence and ability to explain our continuous learning adaptive action process to others. The first question is, and remember these are also on your handout with these reflection questions that you can jot your answers down there and then submit those to Anna and myself. The first question is, to what degree do you feel able to explain our continuous learning and adaptive action approach to your stakeholders? Question 2, what, if any, questions do you have about our continuous learning and adaptive action approach? 3, what, if anything, would help you feel more ready and able to share our continuous learning and adaptive action approach with stakeholders? So go ahead and hit the pause button now for a moment and take time to reflect on those questions and jot down your responses. Okay, so let's go on. Before we dive into the prepare phase, let's first pause to learn about the conditions for effective implementation. In the first webinar, we talked about why implementation is sometimes ineffective by naming some typical challenges, some of which have to do with our strategy design and some that happen during implementation. We also acknowledge that there are both known and unknown barriers to implementation. So some of which we can plan for and others which we can only identify and course correct as we go. Now let's focus on what we can do to enhance implementation by focusing on the conditions for effective implementation. Understanding the conditions can help us be more mindful and intentional about designing our strategies and managing implementation in a way that can lead to better results. So what are some reasons it may be helpful to know about conditions for effective implementation? This photo may provide a clue. Here's one thought. Often we are eager to go right from strategy design to implementation. However, in our haste, we can fail to pay attention to and design for the factors or conditions that can help us not only successfully transition from strategy design to strategy implementation, but also remind us of what we need to pay attention to during implementation so that we can course correct if necessary. For example, we may be eager to move ahead with implementation after strategy design, but we failed to make sure that we have engaged critical stakeholders. Without their awareness, buy-in, and support for the strategy, it may never get off the ground, regardless of how good the strategy may be. Even in later implementation cycles, we may need to make sure stakeholders are still engaged and committed to the effort to keep it going. In short, the conditions remind us of the critical factors that influence the success of our strategies and implementation. Like the bridge and roadway in this photo, the conditions help us navigate through the implementation process and keep us on the path to success. So let's take a closer look at these conditions. So remember, these are the critical factors that influence the success of our strategies and implementation. Here I will describe each of the conditions and share example questions we want to ask ourselves throughout the implementation process. Later in the webinar, we'll take a closer look at each one. Before I describe each of the conditions, let me note how I'm using language. I'm using strategies in these descriptions, but as we know, almost always we will have a wolf pack or set of strategies to influence the system changes we're targeting. So when I say strategy, know that it can mean one strategy at a time or several strategies all at once. So adoption. Adoption means stakeholders agree and support the initiative or the strategies. Let's stick with this example of trauma-informed care training for early childhood teachers and caregivers. A few questions we might ask ourselves are Are stakeholders aware of the need for trauma-informed practice in early learning and care settings? If they are they committed to doing something about it? The next condition is use. This has to do with whether strategy is used effectively. We might ask, if we're going to provide training on trauma-informed practices, how will we know if providers are using the practices, using them effectively, and continue to use them? We can't assume that training automatically guarantees this will happen. Scale is the next condition, and it really has to do with whether or not the strategy is permeating more of the system to affect more people and settings. We might be asking ourselves, for example, how over time will we expand our efforts to reach more providers and therefore more families? How might we need to support agency managers and directors so that they can effectively create the conditions within their own settings to support trauma-informed practices? Next is dose. Dose has to do with the strategy being powerful enough to create a positive impact. Dose questions are, for example, how will we know how many providers, managers, leaders we're reaching with our strategy in our training? How many and which ones do we need to reach in order to make a population level change for children? Finally, sustainability is the fifth implementation condition, and it really has to do with, do we have a sufficient set of strategies, in some cases it may require additional strategies, that shift enough of those system characteristics, that's things like mindsets and connections and regulations, that further align the system to support, sustain, and further improve outcomes in the system and with children and families. So questions we might ask include, what are other system characteristics, again, like mindsets or connections or regulations, that we must also address to assure that the system is aligned and supportive of the changes we're trying to make? How will we eventually shift responsibility and accountability for the result of using trauma-informed care practices to agencies themselves rather than the network? So these are the 5 implementation conditions that we'll be talking about here in a little more detail. You will not always use all 5 conditions, will not be relevant at any one point in time in your implementation process, but across the lifespan of integrating and implementing your strategies, you will want to think about these conditions at different points in time. All right, so now let's focus on each of these conditions in a little more detail. There are several elements to each condition. After we talk about each condition, you may want to pause the recording and look at the conditions for effective implementation handout that you see there, and a picture of it in the lower right-hand corner of the screen. This handout includes descriptions of each condition, the elements that we're going to talk about now, and provide sample implementation questions, kind of like the ones that I was just sharing, that you can consider as you're in your implementation process. Another purpose of this handout is to provide these core questions. These can be very helpful as you begin to reflect on the status of these conditions through implementation. And while the questions may need to be shifted slightly depending on which cycle you're in, the essence of the question remains the same. I'd also like to suggest before we get started here that to make this new information the most practical, I suggest you pause to review the handout and make notes about which questions might be important for your network to consider at this time. Even if you're not into the implementation phase yet in the work, you may still find, for example, if you're in strategy design, being aware of these conditions and thinking about them up front as you do design your strategies may help you design for these conditions before you even get to implementation. Okay, so let's get started. The first condition again is adaptation. There are 3 elements that are part of the adaptation condition. Excuse me. So the first one is awareness. This is really about stakeholders being aware of the need, the initiative, or the strategy. Sometimes it's hard to get, for example, providers to be interested in doing training on trauma-informed practice if they're not even aware of the need to address the prevalence of ACEs or trauma in our community. Buy-in is closely related to this. Not only do they need to be aware, but they have to be bought in. Do stakeholders actually believe in and support action on the needed action or strategy? Again, they're not going to participate in strategy, or excuse me, in the training if they don't believe it's actually necessary. And then finally, the third element of this particular condition has to do with capacity. And that is, do stakeholders have the ability to act? Second condition, as you know, is strategies. Are they used effectively? Again, there are three elements to this particular condition. And in this case, these three elements are very similar, but are kind of point in time reference. So initially, is the strategy being used by the intended stakeholders? So are those providers who attended the training, are they actually beginning to use the new practices that they learned? You're also going to want to check to see, are they using those strategies in effective ways? Just because we learn a new strategy or practice doesn't mean that we always implement it or put it in place effectively. So not only are they using it, but are they using it effectively? And then finally, we also want to make sure that they're continuing to use the new practices. We want to see that they've become a new way of working for both those providers who are using the new practices, but also that the organization now is thinking about trauma-informed practice as a central way to how they care for and support learning for the children in their care. The next condition is scale. And this again refers to strategies permeating the system to affect more people and settings. When we think about scale, there's two elements to this. The first is spread. Strategy is reaching out to include more people, agencies, and sectors. So for example, perhaps initially you focused your training on early learning and care settings in a particular community within your broader geographical area of concern. But then in another round of or cycle, you began to spread and you went into additional communities. There's a number of different ways that you can spread, but the idea is that each time you're reaching out to include more people or more agencies or even spread into other sectors. The other element here has to do with depth. So not only reaching kind of across through your spread to reach more people, agencies, and sectors, but permeating more levels within agencies or sectors. So if the training primarily focused on those teachers and caregivers who are working day in and day out with children, what additional strategies, supports need to be put in place to support those managers and perhaps agency leaders who can put in place policies or accountability measures to assure that those practices are continued well into the future. The next condition is dose. Again, strategy is powerful enough to create a positive impact. With dose, we want to look first again at reach. Is it reaching an appropriate number of people to create a significant change? It's great for every provider that we reach with our training, and if they are indeed making an impact with their practices with children, that is a great thing. And that great thing can even be better when we're reaching more providers with this training, and therefore more children and families are benefiting as a result. But dose also has to do with strength. So the strategy is strong enough to create the desired results. So in this case, it's not about how many trainings we're doing, but is the training that we've designed, is it strong enough? If it's only one training that we've developed, is that one training providing those providers with all they need in order to be able to learn and put the new practices in a place and do it so effectively? Or are other strategies needed? Or is that training need to be enhanced in some way to also help support those providers? Reach and strength are two important aspects of dose that we need to take a close look at. And then finally, sustainability, which may be down the road, but in many regards, you may want to be thinking about sustainability from the very beginning. But this really has to do with whether or not we have a sufficient kind of wolf pack set of strategies that can help us target more of the different system characteristics that can further align the system to support, sustain, and further improvements. So we may have started out working on system issues that pertain to a certain root cause chain, but we know that there's actually other root cause chains in our root cause analysis that have a great impact on the ability to provide this training, but also on the ability of those teachers and caregivers to put the practices in place. So with sustainability, this reminds us to circle back to some of those earlier root cause chains that we didn't prioritize initially and begin to focus on those so that we can actually change more system characteristics and help the system be more receptive to the change and not want it to just convert back to the way it was once there's not as much focus provided. So 3 different elements of sustainability, one of which is alignment, which is what I was just talking about. Again, we're making sure that we're shifting at least 2 or 3 of the most powerful system characteristics related to the issues that we're addressing so that we have good reinforcement for the strategies we're working on. We also, at some point in time, want to shift the ownership of providing the training and monitoring and supporting the practice so that the people, the organizations, and the group who are actually taking this training and now committing to the practice are taking ownership for the continued use and effectiveness of those strategies and practices. And finally, that there's some kind of accountability in place, whether that's with the network overall, whether that's within the agencies, or maybe it's some kind of combination, but that there's measures and systems in place that can help us promote and support long-term accountability to sustain this effort and the improvements as well as the impacts that come from these strategies. So now that we've unpacked each of these conditions and you've taken some time to read the related questions and consider which conditions and elements are relevant to your work at this time, let's go ahead and talk about these conditions can enhance implementation in general. All right, so the question is, how can the conditions be used to enhance implementation success? You now know what the conditions are, and you have some questions to help you think about it. But let's just kind of sum up kind of the 3 ways that they can really help you enhance implementation. The first of which is they can help you identify what may be getting in the way of effective implementation. So if you realize that, for example, maybe the dose of your strategy, that training isn't sufficient, you need more or an expanded set of trainings to actually help those caregivers and teachers be able to implement the practice more effectively. So now that you know that, you can address those through new strategies and new training. Another way you can enhance implementation is to identify where strategies may need to be developed and or expanded. So very similar, once we realize where what we're doing isn't quite sufficient, we can then either expand strategies or develop new strategies to address the conditions. And then finally, by focusing on these conditions, paying attention to them, documenting and tracking, how we're doing relative to those conditions, they do provide yet another way to demonstrate and document your progress. These actions that you're taking to address these conditions are critical actions that are implementation actions. So we want to make sure that you give your community credit for this important work. Okay, so how will you know the status of these conditions through implementation? You will do this as you work through each pilot cycle. Think about it as another kind of simultaneous layer that happens as you implement your core strategies. Here's how it looks. So as you know, the prepare phase is about getting ready to implement your strategies. And we're going to dig into that a little bit deeper next. But at the same time, it's also an opportunity for you to consider the conditions and what data you may want to be collecting during this round of implementation. So not only what data, but how will you collect that data? Then as you implement your strategy, we know that we want to support effective implementation. And one of the best ways you can support effective implementation is to gather rapid feedback on these conditions, as well as, how's the strategy going? By looking at both of gathering data on both of these things during implementation, it's going to set you up then for the learn phase, which is where you want to be able to reflect on and learn and understand, okay, what's working with our strategy? How are we doing relative to the conditions, and what didn't work with the strategy, but also then reflecting on those condition data and needs so that we can really identify what may need to be modified, expanded, or perhaps scaled with the strategy because we know what's working. And at the same time, we determine which conditions need more attention as we move into the next cycle. So let me just say that you may not need to focus on every condition through every cycle, but periodically you should reflect on all these conditions and then adapt your next cycle accordingly. So to summarize, your essential conditions checklist is as the following. First, consider which conditions need attention. Again, do this periodically, just to kind of remind yourself of what you need to be paying attention to as you are in the implementation process. In order to really kind of reflect on those conditions well, you're probably going to need to gather some data from system stakeholders to know that current status. You're going to want to keep track of the status of each condition. This doesn't have to be overly formal, but you do want to know, for example, okay, how many trainings have you provided? How many stakeholders, caregivers, and teachers have attended? Which communities are they from? Those kinds of things will help you then, for example, look at your reach. Another thing you're going to want to do is, like we said, reflect on the current status of the conditions. So as you've documented the reach, now step back and say, okay, so where haven't we been yet? Where do we know there's still a great need? Where we know there's a lot of trauma happening in a particular part of our community? Are there other early learning and care centers that we want to focus on in order to make sure that they're getting that training as well? And then finally, consider strategies need to be expanded and or developed to address any of the conditions. And like we talked about a moment ago, you can do this in parallel fashion with your strategy design anyway. So it's just another dimension to look at as you go through. So let's pause again for reflection. There's 3 more questions I'd like you to take some time to reflect on, either now or at the end of the recording. The first question is how might knowing these implementation conditions improve implementation effectiveness? The next question, which of the 5 implementation conditions tend to be overlooked in your community? Now that you understand these conditions, what could be done differently? And 6, which of these conditions and the related elements are most relevant to your work at this time? Again, wherever you're at in the process, are there any of these conditions that you know are going to be important to address either in your strategy design and or in implementation? So go ahead and pause for a moment if you'd like to reflect on these now. Otherwise, we're going to move forward to our last section where we're going to focus our attention on the prepare phase of the PILA cycle. Okay. So why does our PILA cycle begin with prepare? I bet you already know the answer, whether you're aware of it or not. Just like we talked about earlier, often there is work to be done to get from strategy design to strategy implementation. We have to make sure we have a good bridge from strategy formation to successful strategy implementation. My guess is that many of you naturally prepare without necessarily acknowledging it as such. So with the next couple of slides, pay attention to how much of this you already do well as, what's new for you? What hadn't you ever really kind of thought about before? Before we dive into the prepare cycle, I want to be clear that the work associated with the prepare phase or any of the PILA phases is taking action on your strategies. It's important that we help our partners realize this. The work that is done in each phase of the cycle is critical to our success. It's important that we help stakeholders realize first the critical need to make sure we're prepared to act. It's also important that that the work we do to prepare is action. Often stakeholders will feel like the preparing is just more talking and not about doing, but in fact the preparations that they are spending time doing is actually an action. And so you should make sure to record these actions in AOK Connect to show your progress on any approach and strategy that you do as you move through these cycles. So let's walk through a strategy example and see how the prepare phase can help us think about early implementation actions. All right, so we're going to continue to stay with the same example around providing training on trauma-informed practices to early learning and care providers. So what might need to be done before you could implement the training that is being referenced in this strategy example? As we walk through this example, you may want to reference an updated version of the Continuous Learning and Adaptive Action course cycle details I provided for the first webinar. In this version, I have added what we just learned about the implementation conditions. The questions I will share in the following slides are adapted for this specific training example. One of the first things you're going to want to do is think about who to engage in general. So who are the stakeholders who need to be engaged to provide an effective training? To what degree do stakeholders know about this training? Then think about the reasons why you may want to engage them. So some of the reasons that you may want to engage stakeholders, for example, could be to gather input. You may have questions like, what do early learning and care providers already know about trauma-informed practices? What practices are already commonplace that we don't need to necessarily train on, but just reference? What kind of training will be most helpful to them? These are the kinds of questions that we might want to find out before we finalize our training. We also may want to ask a few questions about their current level of awareness and buy-in. How aware are people about the need for trauma-informed practices in our community? Who needs to buy into this idea of trauma-informed practice in early learning settings? What might help to generate this buy-in before you start offering the training? These are the kinds of questions that we need to think about. Another way we might need to prepare is to develop materials and/or processes. So, for example, we may need to be asking ourselves, okay, so what is our training design? What's this training going to look like? How long is it? Who's going to be providing it? What materials will be needed? How are we going to promote it? What promotional materials are going to be needed, etc. All these things need to be developed before you can actually move on the strategy, which is actually to provide the training. You may also most likely need to think about how you're going to do your evaluation. If you're doing a training, you're going to want to know what people learn and take away from that. So how are you going to measure the effectiveness of the training? How will you collect feedback to continually improve the training once practitioners have come and go back to begin to put the practices in place? How are you going to know how that's going for them and what else is needed, or how you can provide further support? What materials will need to be developed for this evaluation and learning? Are you going to have a survey, for example? What kind of tool are you going to provide? And how will you know if the training changes practice and improve outcomes for children? That's a big question that you'll want to ask yourself and figure out how you're going to be able to determine that. Another area of work when you think about preparing is around building capacity. And this one can be a little more nebulous depending on what your strategy is. But we want to first think about individuals, right? And so what is the needed knowledge, skills, and supports that are needed? Who will provide the training? Do they have the background experience to do so? What else will training participants need to be able to do to develop their ability to put trauma-informed practices in place? So we also then want to turn our focus to the system. And so is there capacity within the system, for example? Is there a feedback loop? What's the process by which we'll follow up with training participants to know how it's going implementing the new training trauma-informed practices they are learning? How can training participants reach out, and to whom for additional support? So it's putting some of those things into place, both first thinking about the individuals and the capacity that they're going to need to be able to, for example, provide the training, but then also thinking more as a system as a whole. What's the process or the procedures that we're going to put in place? In this case, for example, feedback loops that are going to help us continually have the information we need to be able to act and continue to improve the strategy that we're putting into place. And now, after looking at the system conditions, we also know that it's important to upfront think about which implementation conditions are needed to be focused on during this next cycle. So which conditions are critical to address at this time? Are there any other strategies that need to be adapted or developed to address these conditions? And we also need to think about if we're going to collect any data relative to these conditions. Which of the condition data will we be collecting? How will we collect it? From whom will we collect it? All of these are examples of the kinds of questions that we want to be asking ourselves as we think about the implementation conditions. Okay. So one more thing just to mention again, this came from our first webinar, but just to remind us that if it's your first cycle, and I'm strongly suggesting that you use your first cycle as a prototype of sorts, meaning you're not trying to go full scale with providing this training out into the community, that you're doing it on a very small scale initially, right? You're maybe doing one training with one group of stakeholders just to try out the whole process, make sure everything is working well, you got all your pieces and parts in place, and then that gives you opportunity to make any adjustments before you then continue in your next cycle and reach out to expand and reach more people and settings. So these are just some of the kind of questions you might want to think about as you're preparing to prototype, depending on the scale of that prototype. So again, thinking about the purpose of your prototype, what, if anything, are you wanting to learn from that first round, so you can be really intentional about that and have a way to collect that information, knowing who you're going to involve in the prototyping process. Really kind of think critically about who is my main audience for this training. So how can I get those people in a room together so that I really get good feedback on whether it's going to meet the people's needs that I'm most interested in supporting. The format, what actually does this prototype look like? Sometimes maybe you're not delivering the whole training at all, but maybe there's only one part of the training that you're not so sure about, and you want to get people together and find out what more they could tell you about how that needs to be adapted to be spot on when you take the training out full scale. And then feedback, again, how are you going to measure it? So these are things just to think about as you prepare for that initial cycle. All right, one last question as we think about the prepare phase, and that is, how do we document our prepare activities? Two things to think about here. First, with how it goes into your program plan initially, and then how are you reporting it on AOK Connect. So I think simply the two things to remember are, first of all, if your prepare actions are specific to an existing strategy, or that you're designing them up front when you design your initial strategy, just insert them right into your program plan as action steps. If you've already developed your your program plan, but you still need, but you determine that you want to add some additional action steps to any given approach or strategy that's in your plan, then just insert them, add them in as action steps, and then you can report on them accordingly. If the prepare actions include developing a new strategy, you'll find that you need to create a new approach. And so you can do that in your program plan initially first, and then into your AOK Connect when you do your reporting. Okay, so let's go ahead and summarize what we've covered in this webinar, and then we'll get to our last set of reflection questions. So in summary, first thing we have to remember is, just like that bridge image that we've looked at a couple times, often there's a gap between the original strategy design and the strategy implementation. We did some really good work with design, but we didn't necessarily think about everything that's going to need to be put in place before we're actually ready to act on that strategy. The conditions help us navigate through the implementation process and keep us on the path to success. By considering these conditions, it can help us remember what else we may need to put in place to mine that bridge between strategy design and strategy implementation. We also have to remember, and we have to help our partners remember this as well, that prepare actions, anything we're doing to prepare to move into implementation, are actions. They're actually implementation actions. It's not more talking, it's actually doing. And so we need to remember this and remind ourselves of this and feel good about the time we spend on those actions. Again, the prepare phase reminds us to take time to do what is needed to be ready to implement our strategies during any cycle. So whether you're in cycle 1, 2, 3, or more, you still will prepare every single phase. It may be less and less you need to do to prepare, but we should always pause and reflect and think about what we needed to prepare before we move on. And then finally, the actions we take in the prepare phase are critical first steps towards effective implementation. Remember to report these efforts and give you and your community credit for doing so. Okay, the last set of reflection questions, and you'll be wrapping up this webinar. So question number 6, in addition to engaging stakeholders, developing materials, building capacity, and focusing on relevant implementation conditions, what are other ways you may need to prepare? Question 7, in your own words, why is the prepare phase so important? And finally, question number 8, what is an example from your current work? Could be any of your initiatives, not necessarily the Child and Family Initiative, where there is a clear need to prepare before taking further action. Again, please take a moment now to reflect on these questions and jot down your responses on the handout. And then when that handout is complete, please email that to Anna Maria Ekove and myself when you're complete. Thank you for spending time with this webinar, and I look forward to connecting with you on webinar number 3. Thank you and have a good evening.